The Kaiser Family Foundation presents Health08.org, election news, analysis, and events.
Senator Edwards, thanks for joining us on Health08.org today.
Thanks for having me.
Before we get to the specifics of your health care reform proposal, let's talk about the philosophical underpinning, your philosophical approach to health care policy. What is it?
That as a moral issue, everyone in America should have health care coverage. There shouldn't be any distinction between one American and another about who has health care coverage. So universal coverage. Second, that we have to do something serious about to rein in health care costs, which I think are out of control. And third, on the big debate that often exists in my party, which is between single-payer health care versus a continuation of the private system. I have decided to let that debate take place in real life, in real time, and let Americans decide which they think makes the most sense as they choose their health care plan.
Well, discuss your plan for a moment so people can understand what you mean by that kind of middle ground that
Sure.
you're at.
Basically, what my plan does is it mandates coverage. There's an individual mandate. Everyone has to be covered. There's an employer mandate. It basically asks responsibility from everyone concerned. So the employers to continue to play an important role, individuals play a role, and the government plays an important role. All three are critical.
And if a small business, for example, could not afford or could not find a policy for its employees, they would pay into a fund?
Correct. But it's also, remember that small business, the employees of small businesses also have access to the Medicare Choice. So remember, there continue to be multiple choices. And I actually believe that in my plan, the two greatest beneficiaries are, number one, the uninsured, and number two, small businesses. Because small businesses today have huge problems with providing health care for themselves and for their employees because they have no market power. And the result is they pay the highest possible premiums. We're going to give them market power.
But for those small businesses that at the moment don't offer any coverage, they probably don't feel like they would win in your plan.
No,
because they would end up paying more, something that's
I would
not paying now.
respectfully differ with that. I think they will feel like they win. The vast majority of small business owners that I have run into in the country want, number one, to have health care for themselves, and number two, to have health care for their employees. And they just can't pay for it. And the result is they have trouble attracting people, they have trouble keeping good people. What this does is it essentially it eliminates the burden for most of the employees, and it reduces it dramatically for the employers.
When I heard you in the presidential forum downstairs here in the Kaiser building, it seemed to me that you were almost suggesting that this is something of an experiment, what your proposal is. And at the end of the day, we could very well end up with a single-payer plan if that's what the American people decide that's what they want. Is that a fair description?
I don't think I would use the word experiment, because experiment suggests that you're going through a process to determine what's going to happen. There are some dramatic, bold reforms in this proposal at the very outset. Coverage for everybody, significant reduction in costs, filling gaps that exist in today's healthcare system, pre-existing conditions, no more, banned as a matter of law. Mental health parity, chronic care, preventive care, long-term care, all covered. All huge. Every one of those things in isolation. Huge issues in today's healthcare system. People will be able to take their health care with them if they move or change jobs. A huge job lock is an enormous problem in today's healthcare system. So those things are all being dealt with head on. There is a modeling of the question of whether private versus government plans are more efficient, more cost efficient, and provide better care. And then on that issue, Americans will, over time, make the decision. But I think the problem with describing it as an experiment is it fails to recognize all the dramatic reforms that are instituted originally, including universal coverage.
Would you like to see the trend, though, move towards a single-payer plan?
I don't want to make that choice. I want Americans to make that choice. I certainly have no objection to single payer as a philosophical matter. Mm-hmm. Medicare Many Americans are very happy with Medicare, with some exceptions, the problem with drug costs, etc. The administrative costs associated with Medicare is significantly smaller than private insurers, about 3 or 4%. So there are real advantages in the government plan. But what we're going to find out over time is whether American healthcare consumers believe that they're better than the private plans.
I have heard you say that on the campaign trail that the way to go is not incremental steps. It's time to be bold on this subject of healthcare reform. But as you know, more than most, there is a huge gap between what a candidate can talk about and what a president can deliver. So what is negotiable for you? And second, how do you break the traditional political logjam and get something bold going?
Well, the better way to describe it is what's not negotiable. Universal is not negotiable. High quality of care is not negotiable. Significant cost reductions are not negotiable. Those things have to all be part of whatever proposal is signed into law. So those are not negotiable. The specific mechanics of some of the details, nobody made me the god of healthcare. I've spent a lot of time on this. I've thought about it a great deal, and I think my proposal makes a lot of sense. But if in dealing with the Congress there are minor things about the mechanics that need to be negotiated, we'll negotiate about that. If somebody wants to negotiate about universal or quality of care, though, that's not negotiable. That has to be true.
And those are the big ticket items: universal care, cost of care, access to care.
They are.
So how do you break the political logjam?
Because the mistake that's been made in the past is the mentality that exists in Washington. And unlike President Carter, who came in completely from the outside, I've been here. I know how the Congress works. I know how the Senate works. I know what the relationship is between the Congress and the President. But the mentality that exists in Washington is that you negotiate with the entities and the interests in Washington and come up with a proposal that you then present to America. I just think it's backwards. What you do is you make the case to America about what needs to be done. You shouldn't ignore that the rest of the country, couldn't pretend the rest of the country doesn't exist or shouldn't have a voice in their own healthcare system. And I use as an analogy something that's happened recently, which is there was broad support for this war in Iraq. That support has consistently eroded until it's now an unpopular war. So if you look at what's happened, it's not like the Congress has led on this. The Congress has followed because the American people are demanding change, and now even Republicans are demanding a different course in Iraq. Exactly the same thing, except easier, would happen with health care. I mean, that's when the leader of the country, supposedly, George Bush, is leading in the wrong direction. Suppose the President of the United States is actually saying to America, this is what we need to do. We need universal health care. We're going to cover everybody. You still have choice. We're going to bring costs down for everybody. And convinces America about the need for this. When that happens, the politicians will follow. There's absolutely no doubt about that. So I have a very different perspective and mentality about how to get this done than some others.